There is a conversation I have regularly with patients who are doing everything right and still not losing weight from their abdomen. They are eating well, they are on medication, they are exercising, and the belly fat isn't moving. The first question I ask, tell me about your stress level. Here is the biology. When your brain perceives a threat, a deadline, a conflict, financial pressure, a difficult relationship, the hypothalamus activates the HPA axis, and the adrenal glands flood the system with cortisol. This is the same mechanism that will help you outrun a predator. The problem is that chronic stress keeps this system running continuously, and cortisol, when persistently elevated, does something very specific. It targets visceral fat, the fat surrounding your abdominal organs, preferentially because visceral fat cells contain significantly more glucocorticoid receptors per cell than subcutaneous fat anywhere else in the body. Healthy cortisol follows a diurnal pattern: high in the morning, dropping through the day, lowest at night. Chronic stress flattens that curve. Cortisol stays elevated from morning through late evening, disrupting sleep, raising insulin resistance, and continuously signaling the body to store fat centrally. Here is why it's specifically belly fat. Visceral fat cells have much higher density of cortisol receptor than subcutaneous fat, and they contain an enzyme, 11 beta HSD1, that converts inactive cortisone into active cortisol locally, amplifying the cortisol signal inside the fat cell far beyond what a blood test would show. The visceral fat is, in effect, producing its own cortisol environment, and as visceral fat accumulates, it drives more cortisol production. The cycle accelerates itself. The other mechanism is appetite. Chronic cortisol activates the mesolimbic dopamine system, the brain reward circuit, specifically toward high fat and high sugar foods. This is not a preference, it's a pharmacological signal. The craving that appears suddenly and urgently, specifically for something sweet or salty, not just anything. That is cortisol talking. Real hunger builds gradually over hours, accept most foods, and resolve after eating. Cortisol driven craving appears suddenly, targets specific foods, and often persists after eating. The pause test. Wait 10 minutes. If it's hunger, it stays. If it's cortisol, it often passes. What chronic cortisol does to a weight loss program: increase visceral fat storage rate, elevates insulin resistance, amplify appetite for calorie-dense foods, promotes muscle breakdown, disrupts sleep quality, and reduces the effectiveness of GLP-1 therapy. Because GLP-1 operates in a hormonal environment that cortisol directly antagonizes. The practical response: consistent sleep of 7 to 9 hours is the strongest cortisol modulator available. Poor sleep raises next day cortisol 15 to 20%. 20 to 30 minutes of zone 2 exercise produce an acute cortisol spike that then drops below baseline. Daily walks measurably reduce cortisol levels. 5 minutes of diaphragmatic breathing activates the parasympathetic nervous system and produce measurable heart rate variability improvement within the session. Moving caffeine cutoff to noon prevents evening cortisol extension, and identifying one chronic stressor to remove, a relationship, an obligation, an environment, matters more than most patients expect. Stress is not a side issue in weight loss medicine. It's a metabolic driver with a documented biological mechanism. If you want a program to address the full picture, text me at text2md.com. Thank you for watching.